Hello everyone. In this video, I'm going to be going over pulse rates, where to find them, how to find them, the different depths, and what is normal and abnormal with pulse rates. I'll also be going over respiratory rates, the process of calculating that, what is abnormal and normal, and finally, I'll be going over blood pressure, how to set it up, and what is normal and abnormal in that. So with pulses, there's many different places to find the pulse on a person, and I'm just going to go over three. So one of them is your radial, your carotid, and your dorsal pedal. So the radial is usually pretty easy to find. It's at the distal end of your radius, and the depth isn't, you don't have to press really hard to find this one. Your carotid, however, you have to press just a little harder than your radial, but it's generally not too deep, and you can find it pretty easily on a person. Now, the dorsal pedal, on the other hand, can usually be harder to find because it's at the base of your first and second metacarpal. So that one, you don't have to press really hard because sometimes you won't find it if you press too hard. You have to just find the right depth. It's different in every person. And the normal beats per minute in a person is usually in between 60 and 100. Anything far below 60 or anything far above 100 while resting is considered abnormal. So with respiratory rate, you are counting when they breathe in and breathe out. So when they first breathe out, you are going to either look at a clock or look at your watch for 60 seconds, and you're going to really focus on when their chest pops out, if they're a chest breather, or if they're a stomach breather. And you can look at their shoulders too as well. And when you do this, usually in a hospital or just wherever, you want to act like you're taking their pulse so they don't breathe abnormally or just trying to be funny or whatever. And when you do it, the normal is usually in between 12 and 18, and abnormal is 10 and below or 20 and above. And lastly, blood pressure. So when taking blood pressure, you're going to want to have the patient seated, feet on the ground, have the legs parallel. You don't want them crossed or anything because that can mess up the reading. You want to have their arm sitting on a table parallel or at level with the heart. And when you do it, you're going to have the blood pressure cuff on their bicep with whatever arm you have it on, have the arrow pointing down with the brachial artery. You're going to put the stethoscope medially to the bicep tendon. And when you're taking blood pressure, you're going to want to hear the first little bump or thump. That'll be their systolic. And as it goes down, when you hear their last little thump, that'll be their diastolic. And you usually want to pump up the blood pressure cuff depending on the size of the person. Usually around 140 to 160, depending on the size of the person, as I said. And when you take it, the norm is usually 120 over 80, and abnormal is 139 systolic over 89 diastolic. And anything greater than that too is usually not, well, it's usually abnormal. They have very high blood pressure.